Okay. Well, if other people trickle in after we get started, that'll be just fine. So thank you everyone for joining us tonight. My name is Cassandra Haddad, and I'm thrilled to be the vice chair of our group and the legacy. So before we get started, I'd love to tell you a little bit more about our group. And the Legacy is the only organization dedicated solely to the needs of those at risk for genetic ALS and or FTD. We have four aims. They are to support education, research, and advocacy for our community. And if you're interested in joining us or learning more, please feel free to reach out to us. We'd love to share with you. Tonight, we're thrilled to bring you a panel discussion from three of our group members who are all healthcare providers. We'll start by introducing ourselves and what inspired us to get into the medical field. So I'll go ahead and start. As I mentioned, my name is Cassandra Haddad. I am a nurse practitioner, and I'm also an SOD1 carrier. We've lost 33 people in my family to SOD1 ALS, the last of which was my mom in August of 2022, and she was also a nurse. Even though my mom was a nurse, I actually never had any plans on going into medicine until I was already enrolled in college. I tried on several majors, including art. I have zero talent, so I quickly moved on. And actually, my sister's dog had puppies, and I thought that was pretty incredible. So I decided I was going to be a midwife, because if puppies being born was that cool, humans had to be a lot cooler. As I went through my training, I quickly discovered I did not want to be a midwife by any stretch of the imagination, but I was already in nursing school. So I went ahead and finished my degree and went into the emergency room. And then I worked for many years in nursing education, teaching nurses at all different levels. I really loved nursing, but I knew I wanted to do a little bit more. So I went on to be a family nurse practitioner. And I loved family practice, but I wanted more time with my patients and I wanted to work a little bit outside the box. So I actually transitioned to my current role where I work in functional medicine. And I absolutely love that. So let's move on to Amy. Lindy, I'd love to hear you introduce yourself and what inspired you to join the medical field.
Sure. So my name is Lindy Jacobs. I was born Lindy Lee, and I loved my maiden name, but my mom always wanted us to have unique names. So I'm one of three girls. I am from the Twin Cities, Minnesota. I currently live in Western Wisconsin, though, kind of moved out to the country. So I am a third generation family with FTD, so frontal temporal dementia. And my maternal grandmother had the disease. My mother had the disease. And then now I have two uncles and an aunt who are also currently symptomatic. My mom underwent diagnostic testing for genetics in 2019 and was found to have the MAPT gene, so the tau protein. And then in 2021, I underwent genetic testing as well to find out my carrier status. And I am also a pre-symptomatic or asymptomatic positive genetic carrier as well of the MAPT gene. Um, so I am a third generation, and then after me, we have six kids in the fourth generation of children. I am one of three girls, and all three of us are also positive carriers. So in my family, we seem to have quite a strong gene penetrance and are proving, defying the odds of 50% and hitting it with 100% in two generations. So, so that's kind of my background with my genetic predisposition as well as FTD. And what inspired me to get into the medical field? So I'm a registered nurse and I've kind of dabbled in quite a number of things. I've done hospital nursing, I did postpartum nursing, and then in the last 7 to 10 years, I've been doing surgical nursing. So I work in the operating room as well as doing preoperative and postoperative care. So I am not like Cassandra, and I don't want to go on to get further education. I was quite content with just having my nursing degree, and I kind of like being just a staff nurse, is how I call myself, because I am not management or leadership material. I just like to come in, do my job, and then head out at the end of the day. Um, but what shaped me as a nurse was actually my mom was a physical therapist, and so she worked for a family practice doctor And back then it was a single family practice and you had all your different departments within under one building. So you had radiology, you had physical therapy, you had your dietary, you had your phlebotomy all in one building. And then you were treated by family practice physician. And so I essentially grew up in a doctor's office. If we didn't have school, if one of us was sick, we would be put in one of the doctor's rooms set up with things to color. So I grew up in that environment. I mean, I know it's something that you're not supposed to say as a child that you played doctor because it has bad innuendos, but that's what we did. Like I had models of knees and I had x-rays and I had slings and crutches. So that was how I like learned as a young child was how we kind of played house was playing doctor. Um, and seeing my mom kind of in that field, you know, with your mom, you idolize them, right? That's someone that you look up to. And so that was something that shaped me at least to want to consider medicine. I think also medicine just made sense to me. I'm a very analytical thinker. And so medicine seemed to make sense. But like I said, once I hit school, once I graduated with my 4-year degree, I was good with just being done at that. And also, I mean, being a caregiver shaped my career path immensely. My grandmother was sick my entire life. She started symptoms in 1990. I was born in 88. So my entire life with my grandmother was she was ill. And my mom had a strained relationship, but with her, but found a way to put those past incidences aside to be the caregiver for my grandmother. I watched my mom advocate for her when nursing home supplies weren't in the correct places or adjusting her clothing when her body became more contractured towards the end of her disease, creating soft hand grips for her hands so that it would prevent her from, you know, digging into her skin. Um, and I think that was an incredible thing to witness because it really just shows kind of that unconditional love that you have for your family and your parent, and that it doesn't matter what your past circumstances are, like you can still rise to the occasion to step up as a caregiver. Um, and so when my mom developed symptoms, I played that same role. In the end, before my mom passed, we didn't have care. We didn't have hospice nurses. um, I provided her hospice care. I turned her, I bathed her, I medicated her. And I always said if my whole purpose on training to be a nurse was to care for my mom in those last days, then I have fulfilled my entire life's duty. That's all I needed. That's I to be able to provide that for someone and to witness that passing of them and to be present and to feel stilled. That was my purpose as a nurse.
Lindy, you're killing me. Like that right there is the heart of nursing. Stop saying you're just a nurse. You are incredible. You're the lifeblood of all the providers. And I think everybody on this call just sees, I'm so thankful that your mom had you to care for her. It's truly a gift to be able to do that. Um, Lindy, is there anything else about your family's journey with FTD or MAPT that you would like to share with us?
I think the biggest thing with my family's journey was because we had the family history, it would seem that it would be easier to get a diagnosis. It took us 8 years to get my mom diagnosed. And part of the issue with that, and the part that I struggled the most with, is that because I was a nurse, because I had that insider information on who to call, how to call, like where I need to call, I still could not get her diagnosed. And even in that, I couldn't keep her, you know, she was in and out of jail. She was arrested 3 different times. I had to petition for her guardianship. I called the crisis line, like I was calling social workers, neurologists. Um, she had, she just fell through every crack of the system. And it just felt so wrong when I knew the questions to ask. Like I was asking the right questions, but I wasn't asking them to the right people. Um, and I think the hardest part is as a caregiver, and especially with the way that these genetic diseases play out, be it FTD or ALS, is that the caregivers are often the children of the adults. And when it hits your parents when they're in their 50s or early 60s, you are still very young. I was 22 when my mom started having symptoms. I mean, I hadn't even applied for my own insurance on my own, let alone known how to apply for medical assistance or social security disability. And I had a leg up because I at least knew a little bit about the healthcare system. And so that has been part of my FTD journey, and kind of my intent moving forward is, if my family struggled in that capacity, how many other families are also struggling in the same capacity if they don't have the background knowledge to ask those questions, or they don't know who to go to seek information. Um, and I think it's just a really unfortunate way to have to navigate that disease, because my time was consumed with phone calls and advocating. And at the end of the day, my bucket was empty. You know, I still had to provide for I had young children. I now have a 7 and a 5-year-old. So during that time, I had babies. I was getting married. I was buying a house, starting new jobs. You know, at the end of the day, my bucket was so empty that my tolerance for my mom's behaviors wasn't there. And I think that's part of my biggest mission is I wish I could have been better in those, because that guilt and that regret eats me. But at the same time, I don't think, looking in hindsight, that like my mom would have been upset by that, because I was fighting so hard for her. It's just that I was pulling from an empty bucket as a caregiver. Um, and I think that's always been a part that I've always struggled with as a healthcare provider, is why why are these cracks happening? How can we fill them? And how can I now advocate for others going through that disease? But also, because I'm advocating for them now, that is going to change how I'm advocated for in 15 years. You know, it's going to change. These conversations happening now are going to help everyone else that are currently in this journey, but also it's going to change the course of my journey. And I think that's the biggest purpose now is, you know, my mom drove my purpose before, and now my children are continuing that purpose and that drive to find more.
Lindy, thank you so much. I feel like we could do an entire webinar on caring for the caregiver. You had so many just transcendent points there. And I think a big one is this is why our group exists, because we've all walked this journey and we have got to fight for each other, and we've got to forge a better, clearer path forward, because how can every individual family do this by themselves? It's just mind blowing to me. Amy, is there more you would like to share about your family's journey? I'll briefly share my story. Some of you have probably heard it a couple of times. Like many families, when I was growing up, we didn't really talk much about having this, huge family history of ALS. And throughout my career, I would bring it up to people and be like, hey, I have this family history of ALS. And people would be like, that's not a genetic thing. Like does just happens. So thankfully that's not the common myth anymore. But I remember early on, I mean, I've been in medicine a long time now, but 20 years ago when I was a new nurse, I remember asking a neurologist about it. He was like, yeah, no, that's not a thing. Um, so we didn't really talk much about it. And we actually have an enormous family tree. It's on two giant architectural blueprint sheets. And it was last updated in the 80s by someone up by Lake Chautauqua. I have no idea who that guy is. And that's where the 33 people that we've lost in my family come from, is someone actually went through and documented it. And it hasn't been updated since the early 80s, other than my mom and my uncle. So there's probably more people since then that I just don't really know who they are. Anytime I meet another SOD1A5V carrier, I automatically assume we're somehow related. Um, but we actually kept that family tree rolled up in the back of the closet, like shuttled from relative to relative, and no one really wanted to open it. It was almost like a bad thing. And Bloomberg did a real fun story on that in the video we get it out. Um, but my grandfather died in 1990 and he was 60. And then things were kind of quiet. So everybody kind of forgot about it and ignored it because that's like clearly the best thing to do, um, which it's not anymore. And then out of the blue, my uncle developed symptoms. And so fortunately, our gene was discovered a few years after my grandfather's death. So my uncle got genetic testing. He urged all the siblings to get tested. And sure enough, my mom came up positive. Um, the day my uncle passed, my mom's symptoms started. And so at first, of course, she thought it was all stress induced, even knowing she was a gene carrier. And, I said to her, Mom, what's going on with your knee? And she was like, oh, honey, I'm just, 65, whatever. So at one point, she tried to convince me that maybe she had MS. And I said, Mom, the odds of you getting a rare neurodegenerative disease after having a genetic mutation are probably astronomically low. So eventually she did admit that she had ALS, and we went through a roller coaster of trying to get her, into clinical trials. And that was a lot. But what I will say is, after she had her testing, I immediately enrolled in the Columbia Families Program, got my genetic results. It was during peak COVID, so it was kind of a mess and took forever. But as soon as I tested positive and kind of processed that, integrated that information, I immediately became a fierce advocate. I enrolled in every trial I could. I'm in 4 trials now. A lot of them are just observational, meaning they watch you for a really long period of time. The fortunate part about being a SOD1 carrier is there is a trial called ALS. So I'm very thankful to be involved in ALS. It's kind of got a reputation for a pre-symptomatic trial. It is not. No one's getting medication in ATLAS until either your neurofilaments go up or you develop symptoms. So I always try and kind of throw that little piece of information out there. And like many of us probably on this call, we not only fight for ourselves, but we fight for our children and for this next generation who are at risk for ALS. So thank you so much. I feel like this is just a ton of really good information tonight. I'm so thankful that Lindy and Amy and all of you are here. We have a couple more questions, and then I think we'll have some time at the end to open things up. So Amy, we'll ping back to you now. And you've touched on this a little bit, but anything else you want to say on how being a medical professional has influenced your journey or your family's journey?
It definitely.
Lindy, how has being a medical professional helped to shape your family's journey?
Yes. So like Amy, I always tried to never like full forcedly say like, well, I'm a nurse because just because I'm in the medical field means that I know like this much because I'm in a specialized field, right? I don't know everything, and I don't want to be treated like I know everything. I want to feel like I can be an equal in a conversation. And I think having that medical background, I have been able to have maybe higher level conversations than say like my sisters have had. So I like that it kind of garners that respect in those conversations, but at the same time, I don't want to be treated like I already know these things, because I don't. I don't. And it's so different when it's happening to you versus learning it happening to someone else. Removing yourself from that is a totally different aspect. I always say, everyone asks, how has finding out your genetic status changed you? And it's like every fiber of my being has been changed. Like I see the technical data behind things, but there's so much thought process that goes into it. And perhaps it's because I work in the medical background. Um, you know, but at the same time, it's something you can't be prepared to know what the effects of finding out are. And I think because especially with MAPT, when you receive your diagnosis, there isn't anything for us right now. There isn't, at the time in 2021, there wasn't support groups. There wasn't really a large population of pre-symptomatic carriers. There wasn't a lot of younger people that have found out their status. And there's no drug trials, there's no gene trials, there's no clinical trials. And so you find out this massive diagnosis and you're left with nothing. When you're diagnosed with breast cancer, you're given a roadmap. You are scheduled for a port placement the next day, and then you're scheduled for chemo 5 hours after that. They create this roadmap for you to follow. And so much of diagnoses in medicine create that cascade for you to follow and give you an idea, or they give you a list of resources. In the FTD world, most of the time you're meeting with a social worker or a genetic counselor. And both in those fields, there has been a large turnover in those careers. And so sometimes you're having someone that's fresh in their career that, you know, would love to give you all the answers, would love to give you the resources, but they're just limited because they haven't been doing it for that long. And that's not their fault. I see that as the broad spectrum, like healthcare crises that we're kind of all in, especially post COVID, is finding people to work, and then also finding people that are knowledgeable in their field. Uh, so I understand that. And so I think being a healthcare provider, I think I have found that I can give a lot of grace in a lot of areas, um, that I can advocate for myself in a way in which I feel like I am holding power in the conversation, um, and that my opinion is valued, and that what I'm saying feels educated and rehearsed, and that I've done my research. Um, and so I think that holds having that respect is so important, because I feel like I didn't have that. There's been a lot of times where I didn't have that in my FTD family journey. And then, like Amy said, having that background knowledge, I'm able to read some of the research abstracts. I looked through with FTD, I looked through all the research abstracts at the International Society of FTD, like, or the ISFTD consortium, and I read through every single abstract that had to do with tau. And then from that, I've reached out. I am making connections on my own simply by telling them my personal story. Um, I've talked to different labs. I've been asked to speak at different events. I've made contact with top researchers that are doing tau related research, because it's going to benefit me. And then also because I can digest that conversation, I can then cut it down into information and digest it for my sisters. And I think that's super important, is to have someone in the family that can take that lead and then guide the rest of the family members, because we're all affected by it. This isn't a solitary disease process. This is a full family effort. Um, and so having that knowledge, and just, I think that's been the biggest thing, is just I feel empowered to have those conversations, and I know how to reach out. I know who's in the field, how to have those conversations. And I always say, like, I kind of have always like never had like a great filter being an operating room nurse. Like, it's a great crowd to be in when you have a bad filter. So God forbid what's going to happen when my FTD symptoms start. But I also feel like right now, I, being a positive carrier, I always say, I've already lost everything, that I have nothing left to lose. And so there is no conversation I won't have. There's nobody that I won't be honest with. You know, I will talk to any stranger about my positive status, or I just feel like hiding it is not going to get me anywhere. So having a loud, like, voice in a respectful manner to gain attention in a good way, right? Like, to gain that attention now, to make people feel empowered to make those decisions, to feel like they have the education from someone that's been through the process. Um, I, I think that's important, is that people can understand it, that I can digest that information and I can verbalize it back to someone that maybe doesn't have that background, and empower them to make those decisions in a situation that's not coerced with like a genetic counselor or in the the room with the psychiatrist or anything like that. So I I definitely think like there's advantages to having had those conversations and caring for my mom, massive advantages. I felt so advantageous being able to have that background. Like I said, I am so grateful that I had that. Um, and I feel so grateful that I have that moving forward, that I can continue to advocate in whatever realm it is, whether it's for myself, whether it's for my children, whether it's for my sisters, my aunts and uncles who are symptomatic, and or anybody else. Like this is a disease, either one of these diseases. I wouldn't wish like that is not something that I would wish upon anyone, and so if I can give tidbits of information to help them along that journey and at least just be a soft place to land during the hardest journey of their life, like I'm an open book.
Thank you so much, Lindy. And I don't have a ton of original things to add to what both Amy and Lindy said because there's really some universal themes. The only thing I would add is, I kind of feel bad for my trial doctors because when I walk in and I have a captive audience, the first thing I do is launch into all my advocacy points, and they kind of brace for impact. And then they have to remind me that not everybody comes in and does this. So I do think that background, does light a fire in us, and it does make us push harder and fight even harder. But I'm going to go ahead and answer our last question first, and then I think if we keep it brief, we'll have some time for questions. What piece of advice would I have as a genetic carrier and a medical professional for others out there? And my advice is go ahead and be that patient. We are in an unfair fight. The odds are not for us, the odds are against us. So you use anything you have to win this fight. I don't care if it's a stone or a stick. I don't care if it's a connection, a friend of a friend, someone you graduated with. You just use all of your connections and all of your resources. Call us, we'll give you resources, but anything is fair in this fight. So you use anything to your advantage. You go ahead and send those chart messages. If it cuts you off at 250 characters like Twitter or whatever, go ahead and send 3 because guess what? That care team is there to take care of you and they are employed by you and you're the boss. So all is fair. The odds are stacked against us. You fight with whatever you got. You be that patient. You pull any title you have. That's what I did. That's what I'll do. And I'll do it for you guys too. So, Lindy, what's your one piece of advice?
I think the biggest thing is that finding out a genetic status or going through that process, again, yes, like you have to be prepared to have your life be immensely changed and that every fiber of your being will be different. But that doesn't mean it's for the worse, right? Like I can't say that finding out made me put me in any other different predicament than what I was already in. I knew going into it that I had a 50% chance of inheritance. Maybe having that knowledge beforehand was like hurt me, whereas my sisters were far more ignorant. They didn't really understand the penetrance as much as I did. And so I was living like I had the disease anyways, right? Like I lived like I already knew it was going to happen. And so knowing now has just, again, like you said, it's just allowed me to have those conversations and not be afraid to ask questions, to push for, you know, having neurologists that I want taking care of me, to have my scans interpreted, to join research studies and to feel like I am providing at least in some capacity. I always say that my biggest goal right now is to create the hardest spell around me, like the most strong circle of support that I can, so that when and if disease symptoms happen to me, those walls aren't crumbling in. That sphere around me is so strong that everyone that is in my intimate family, my daughters, my husband, like they have that whole circle around them supporting them along this journey. Um, and by doing the work I'm doing now and advocating as in any capacity and kind of educating my family too, even my husband, like he'll be able to be a good caregiver, right? Like you're empowering others to provide care in which you provided, how you would want care provided to you, or how you would advocate for them in the same way. And I think that's that's kind of all, like that's how I use my education. That's how I use my background, is just, I mean, I fight like hell. It's, there's not, again, when you're up against a wall, like you don't have any choice. And so I can either go down swinging or I can go down silent, and silent is just not my game plan.
Great. Thank you both. Jean, the chair of our group, just dropped a link in to register for our next event, which will be on May 25th at 12 Pacific. And it's on cardiovascular health and disease progression in genetic FTD. We are an organization that tries to meet the needs for both ALS and FTD, so we do try and have events for both. I don't see any questions that have popped up in the chat. I did respond to some of the great links and things that were shared earlier. So kind of last call for questions here. And I just want to say thank you so much to each and every one of you on this call tonight for taking time out of your busy lives to be with us. We love to share our stories. We love to fight for our community. Amy and Lindy, thank you so much for sharing your knowledge, your stories, your love, your caring. Just wonderful, wonderful call tonight. I'm so glad that I could be here with all of you. I don't see any questions popping up in the chat. If there's something you want to ask, but not so much in public, feel free to reach out to us on social media. We're on all of them now, the Facebook and the Twitter and the Instagram. So I hope that we'll see a lot of you back at our May 25th meeting. And if there's nothing else, just a thank you. You're so very welcome. It's truly our pleasure. Amy or Lindy, open up to any last thoughts you wanted to add.
I guess I don't have anything additional, but I also just want to thank everyone for coming as well.
Yeah, Tara.
I just had a question. I am a genetic counselor, family history of C9. I hear, particularly from you, Lindy, all three of you, your other sisters got tested. Was there any of you who ever kind of regretted running out to get tested? It sounds like you gave it a couple years and maybe you were delayed against your will. But just kind of curious what your guys' thought processes had been around that.
So I was the first of my sibling set to get tested. And I assumed that that's kind of how it would go. Just based on the way my family dynamics work, I'm usually the first one to jump in. And I don't know that my sisters feel regret for doing it. I think perhaps they would if they were the first ones, because I think they would have felt more isolated, and maybe not had that background knowledge or the empowerment to have the extra phone calls or emails or reach out to others. But honestly, once they found out, it was, I mean, we're just kind of in this group where we're like, all right, well, what's our next step? Let's buy a house in the country and we're just going to have a nice secured lockdown facility and we'll just live there together. I think we create humor in something that is not humorous at all, but it is a way to cope, and it's a way that we cared for our mom together. And I think we know that we'll have each other, at least in this journey, that despite maybe everyone else walking out of our lives, we'll always have them. I wouldn't say that they regret their decisions either.
Thank you, Lindy. And we're at the top of the hour, and I want to be respectful of everyone's time, but thank you so much. Great conversations. I'm sure we could go all night. So thank you so much, everyone, for coming out tonight, and I hope that we'll see you again.
Good to see all of you. Thanks for coming.